Yes, eating disorder treatment does really work, but it's important to know that not all eating disorder treatment is the same. Eating disorder treatment is most effective when the person with an eating disorder is matched to the right level of care. And there are actually 5 levels of care. The most intensive is something that we call intensive inpatient treatment. Then there's residential, there's day hospital, outpatient intensive, and regular outpatient treatment where you see a counselor or a dietitian once a week. It's essential that you have your loved one assessed by an eating disorder specialist who can figure out just what the right level of care is for the person. Because if they're not matched to the right level of care, then eating disorder treatment is not as likely to be effective. A couple of other things to pay attention to. Not all programs are alike either. If your loved one does need inpatient or residential care, it's important to ask the program you're thinking of sending them to whether they have outcome studies, whether they have real evidence to demonstrate that the program works. If they don't have such evidence, you might want to reconsider the wisdom of going in that direction. And at the outpatient level, you definitely should see a counselor who specializes in eating disorders. You can't just go to any doctor or any counselor. If someone has not treated a lot of eating disorder patients, they really are not going to understand the complexities of the disorder, and then treatment might not be as effective. So if you match the right level of care, you go to a program that has good solid evidence of its efficacy, and on the outpatient level you go to a specialist, there's plenty of room for hope. Eating disorder treatment definitely works.